Happy Friday, everybody. Welcome to everyone's favorite show about plastic surgery, health, and beauty. This is Nip Talk. On today's episode, first off, popular TikToker Rachel Tussey dies after a mommy makeover. What happened to her? We're going to try and figure that out. And then, where is the safest place to have plastic surgery? I'm going to tell you what the options are and go over the pros and cons of each. And then finally, Looksmaxxing by bone smashing. If you know what this is, you're smarter than I was before I heard about it. We're going to talk about it, and it's all coming up right now. I'm your host, plastic surgeon Dr. Bruce Hermann. Kalee is not with me today. She unfortunately is at a prior engagement and could not be here today, but we do have Brenna in the box, who has promised me that she is going to carry the weight. Hey, Brenna, how are you?
I'm good. How are you?
How is everything? Did you guys miss not doing a show last week?
Yeah, it was weird. I was like, I feel like I have something, and then yeah.
Yeah. So I was in Colorado actually, and it was pretty exciting because I actually had a pretty unfortunate crash. And
oh my
so
gosh.
I've been, like, recovering.
Yeah, you were skiing, right?
Yeah, I snowboard.
Oh, so okay.
But yeah. So it's just, I guess I'm getting old. I took a pretty bad tumble, and
oh my goodness.
I've been kind of recovering. Like my shoulders kind of
a little sore.
A little.
Did y'all fly or drive?
We drove. Yeah.
Okay. Was the drive back painful?
Riding in the car is not too bad. It's like sudden movements. Like if I sneeze, during this episode, you may have to come revive me.
Ow.
Because like my whole chest wall is very, very sore.
Yeah, totally.
And so like just normal stuff is fine, but yeah, I was a little banged up, but it is what it is. I mean, we just did a segment on how skiing is like risky and
how deadly.
Yeah, well, fortunately, I didn't receive a fatal injury. But yeah, it was have you ever snowboarded or skied or?
No, I haven't. I want to. My boyfriend's a huge snowboarder as well.
Oh, is he?
Yeah,
cool.
Every Christmas. They just went to Switzerland this Christmas.
Wow,
so
that's pretty awesome.
Yeah, they might go to Colorado this year for Christmas, but I don't know. We'll see.
I grew up skiing, and then when snowboarding became a thing, I swapped over pretty quickly. So I've been snowboarding about 30 years, and I really do like it. I do like it better than skiing, but when you fall on a snowboard, it's usually pretty violent because the board, like you're going down the mountain, and what happens is the board will catch the edge of the snow, and it just like flips you really quickly.
Yeah.
So
there's like different types of snow too. Doesn't that affect it too?
Yes, it does.
Oh my gosh.
And so it was not fantastic snow up there. It wasn't like really good powder. It was kind of like hard packed, almost like ice.
Oh yeah.
So when I hit, I was just like,
ouch.
Yeah, basically just knocked silly. But I'm fine. I'm not like looking for attention. I just was like talking about the trip. Yeah, but it's been fine. Like I worked this whole week and it's been all right. I'm just, sore, just, like I don't know, like almost like I worked out too hard, but maybe a little worse than that. So,
yeah.
But anything
I'm glad you're back and
that anything exciting happened while I was gone? It was pretty much same old stuff.
Yeah, pretty much same old stuff. Yeah.
Nothing too crazy.
Yeah, I'm enjoying the weather, the warmer weather.
I know, it's been warm. It's been awesome.
Springtime is here.
Yeah, I'm a warm weather kind of guy, so I don't like cold. So as soon as winter's over, I'm like super happy.
Yeah, the allergies are not fun. So that's what I've been battling. But
I fortunately don't have that issue, but my daughter does. And like every spring, she's like, I just hate spring. I'm like, what? How can you hate spring?
No, I don't hate spring, but I just take like allergy pill and I suck it up. So
yeah. All right, you're gonna have to help me carry the torch here since I'm
ready.
Are you ready? Okay.
Yes.
I'm gonna rely on you. Okay. So first off, we got a segment, another really sad segment, and this one is out of Ohio, and this is about the popular TikToker Rachel Tussey, who just recently died after having a mommy makeover, and the situation of it's kind of just unusual or not the usual kind of thing you see when somebody has a really bad outcome. So we were just gonna kind of go over this and see maybe, can we figure out what happened to her. Did you see this? She was all over social media.
Yes, I did.
Oh, I think you actually sent me this one, but I'd already saved it. Like when it popped up, I was like, oh, we should probably talk about this. Yeah. All right, so Rachel Tussey was a 47-year-old wife and mother who also was a TikToker. I hadn't seen her on TikTok before all this went down, but she did have a fair amount of followers. And she was basically documenting her journey with plastic surgery, which is kind of a popular thing these days, where people are like, oh, I think I'm gonna have surgery. This is where I'm looking for doctors. This is how I'm preparing. And I went and actually looked at all her videos, after the fact, and she did a pretty good journey, a pretty good representation of her journey in this whole plastic surgery endeavor. And it was really sad because she even made a TikTok literally right before she was about to go into surgery. And it was kind of hard to watch because she's like, I'm so excited, and I'm starting my new life and all this. And yeah, it was actually pretty sad to watch. So she did go to a legit plastic surgeon. That's the first thing I always want to know when people, have some sort of problem with surgeries. Okay, was this person properly trained? It was Dr. Torque out of Cincinnati. I mean, I looked at him. He looks totally legit, good training.
Not Miami, not out of the country.
That's right.
Green flags.
Yeah, and speaking of that, I've had two doctors call me in the last week about patients who went to Mexico that are having problems. Yeah, I don't know the details. I haven't seen them yet, but yeah. All right, so she went to this very legit doctor, Dr. Torque, for a mommy makeover. It wasn't exactly stated what she had, although I'll talk about that in a minute. And as I said, she did post a video right before she went in saying that she was going into surgery. And then she didn't post anything for like a week. And then a week later, her husband made a post on her account. I don't know if you saw that one, Brenna. And he basically recounted the story of what happened to her. And at the time, she was at the hospital, not the place where she had surgery. This was like a full-on hospital. And she was in the ICU, like on a ventilator. And they basically told her husband that she was brain dead. And so he started, talking about what happened to her. And so I obviously very sad, situation here, but I always want to know what happened, not only because I want to avoid that for my patients, but also as like a learning tool for people. Like, is there something that happened that could be avoided so that someone in the future doesn't have a similar occurrence? And so, the first thing that I wanted to know is what procedures she had done, because as we've talked about on this show many times, the number one surgery for causing death in plastic surgery is Brazilian butt lift. And so, when I looked at the articles on this, it said she had a mommy makeover. Now, you've heard of that term, right, Brenda? Mommy makeover. Okay, so mommy makeover to me, as a plastic surgeon who does this for a living, means that you're having your tummy done, like a tummy tuck. And generally it means something done with your breast, but that's kind of non-specific. It could be a breast lift, a breast augmentation, a combination of the two, a breast reduction. Typically, mommy makeover means you're having tummy and breast done, but not always. I mean, it could mean that you're just having multiple surgeries at once. And I looked through tons of articles. I even went through all her TikToks because I was trying to figure out what exactly did she have. And the only thing I know for sure is that she had a tummy tuck and she had liposuction. So, I mean, that gives you a little bit of information. As I said, I was really curious if she'd had a Brazilian butt lift, but I couldn't find that, but I don't know for sure exactly what she had. And then the next thing I kind of want to know when there's a bad outcome is how long was she in surgery? There's definitely a difference between being in surgery, 4 hours versus 12 hours. And there was no indication of how long she was in surgery. However, I do think that she was in surgery a fair amount of time, because when her husband made the post, it mentioned that the surgery center was basically closed whenever they finished her surgery. Meaning
Interesting.
I
didn't see that part.
Yeah, so it was a very subtle thing. He just mentioned like everybody was gone.
Yeah.
And so to me that indicates that it was the very end of the day. Like the surgery center I work at, they really like you to be done with surgery around 3 o'clock.
That makes sense.
Although it's really, because cases start at 7, so it's like, okay, 7 to 3, 8 hours. But it's very common that surgeries will go a little bit later. But by 5 o'clock, it is pretty dead in there. And so, meaning, people that aren't needed go home, right? So I'm assuming, based on what he said, that the surgery went late. Now, that could mean that she had an all-day surgery that ran super long, or it could mean that they just started her case late. We don't know. So I don't really know how long her case went. But there was one kind of important thing that he mentioned, and he said that after the surgery, the surgeon came out and said, hey, everything went great, she's in recovery. Okay, that's a good sign, right? It wasn't something that happened in surgery, and he's like, oh man, this went really bad.
Yeah.
So the surgeon came out, said she did great. you can, go back and see her. The surgeon left, which is very normal. Some people were questioning, why did the surgeon leave? Well, that's like routine. Like you do the surgery, the patient gets to the PACU, which is the recovery area, and if they're doing okay, you leave. Because a lot of times it's not the only surgery you have in the day, you're leaving to go do other stuff.
And if it's at the end of the day, it makes sense.
Yeah, and it's just not typical because, the chances that somebody's going to have some issue if they're in recovery and awake is it's not zero, but it's pretty darn close. So the surgeon left. He went back to see her. She was talking, heard his voice. He went to talk to her. And then here comes the information that was a little bit, pertinent. He said that the nurse gave her 0.5 milligrams of Dilaudid, which is a narcotic medication similar to morphine but stronger, and then 150 micrograms of fentanyl, which, as we know, fentanyl is a very strong narcotic pain reliever. And shortly after that, she became unresponsive. She went from being awake to being unconscious, and apparently she wasn't breathing. And the nurses tried to put a bag mask on her to give her oxygen, but he said that wasn't going very well. And then the nurse kind of left to go call the surgeon, who, as I said, had already left the building. She came back. It wasn't exactly clear what they did from there. The surgeon shows up and immediately kind of assesses the situation and says, okay, this is not good. We need to call 911 like right now. So they called 911, EMS arrives, they get her in the ambulance, they take her to the local hospital, and from there, the details get a bit sketchy, but she was put on a breathing machine, they ran a bunch of tests, and within 5 to 6 days came to the conclusion that she was brain dead.
That's awful.
And yeah, terrible.
Man.
And he said that someone told him that she went without oxygen for at least 6 minutes.
Oh my gosh.
So there's a lot of information there to kind of parse through. Oh, by the way, there was one thing that I didn't mention. The nurse did give her Narcan. So Narcan is the drug that you give to people if they're ODing on narcotics. Because as you may or may not know, Brenner, or the listeners, one of the things that narcotics does is it can depress your respiratory drive. It can make you unconscious, and you basically just suffocate to death. And so they gave her Narcan, but they said that it didn't do anything. They gave her the Narcan, she didn't wake up. All right, so we got a lot to unpack there to try to figure out what happened to this poor lady. So the first thing that is notable is they gave her all these pain medications, right? And I'm sure you listening to those numbers and the names of the drugs are like, okay, that means absolutely nothing to me. Even myself, I had to kind of like dig into it a bit because I never give fentanyl. I've given Dilaudid to patients. I've given morphine to patients, even when I was doing critical care stuff and we have to do procedures. And so I have a really good idea in like dosages of morphine, what's kind of a normal dose, a high dose, and a dangerous dose. With fentanyl, I didn't. So I actually called one of my anesthesia friends because they use fentanyl all the time, and I said, look, if you had a patient that came out of the OR and you gave them 150 micrograms of fentanyl and a half a milligram of Dilaudid, is that a lot? And he's like, no, that's actually a pretty normal dose. Because everybody online was saying, oh, they gave her too much narcotic, and that's why she basically went into cardiac arrest. And so I kind of thought that was a high dose, but my anesthesia friend said, no, that's actually really normal. It's basically the equivalent of giving around 17 milligrams of morphine, which when I put it in those numbers, I mean, that's a high dose of morphine, but not a deadly dose. I've given more than that to patients that are, in an ICU setting. So, on the face, that amount of narcotic typically would not be enough to put someone into a situation like she was in, where she was unresponsive and not breathing. Also,
interesting, because I feel like that would be like the first sign of like, oh, that could be definitely where it came from.
And that's what everyone online was saying. Everyone online, and of course this is just comments, right? People like talking and like, oh, they gave her too much this, too much that.
Yeah, theories.
Yeah, just theories. And and they gave her the Narcan, which didn't reverse it. However, the timing of that is everything, because if you give somebody, if say you give somebody 1,000 micrograms of fentanyl, which would be a lethal dose, and you give them Narcan immediately, it's going to reverse it, and they may or may not be okay. However, if you give them that massive dose of narcotics, and then they basically stop breathing, and enough time goes by that they get like an injury to their brain, they're not going to wake up. And so the fact that they gave her Narcan and she didn't wake up, I mean, it's important if they gave it right after they gave the medicine, like, oops, we gave too much and we give the Narcan and it didn't work. You're like, okay, something else is going on. But if, like, say, 6 or 7 minutes went by before they gave the Narcan, she could have had a brain injury, in which case she's not going to wake up anyway. So the Narcan is kind of like notable, but it doesn't really explain anything. Also, the dosage that they gave her is not a crazy high dose. I mean, there'll probably be people out there that say, oh, that is a lot. I mean, it's not like a little amount, but I mean, straight from an anesthesiologist I know that is very, very skilled, he's like, no, that's a normal amount. We give that stuff all the time. So, what could have happened to her is kind of like my question. And I do think that given the circumstances, they'll do an autopsy and they're going to figure this out.
Right.
But you always like to kind of know, okay, do we know what happened here? I mean,
yeah. And did she? I can't remember if you mentioned. Did she have any work done before, or was this like her first?
Not that anyone mentioned.
Okay, because that's what I was also wondering.
Yeah. Nobody mentioned that she'd had any work done. She didn't mention she had any work done. Again, we don't know exactly what she had done outside of we know she had a tummy tuck and we know she had a liposuction. I mean, that is one of the most routine procedures I do. I did basically 3 tummy tucks this week.
Yeah.
I mean, there are a little bit bigger surgery for like a cosmetic or aesthetic surgery, but they are very, very safe. I mean, I've done in my career somewhere between, I don't know, 600 and 1,000. Like, I don't keep track, but I just know how many I do a year, and it's like I kind of add up. And like, I've done a ton of these, and I've had one patient that got a little squirrely on me that did fine, and she's totally fine, no problems. But the overwhelming majority just do great. So you like wonder, okay, what happened? Well, going back to the narcotic medication, I mean, it still could be that. As I like to say all the time, you probably heard me say this, common things are common. And if you give people a bunch of narcotics and they stop breathing, it is logical to think that maybe it was the narcotics that did it. And so, again, we stated that dose is not too high, but there is one other thing that you have to consider, is basically this patient was in the OR, was being treated by an anesthesiologist and then handed off to a PACU nurse. Now, if the anesthesiologist, as she was waking up, if she was having pain and they gave her, say, a couple milligrams of Dilaudid, which is a longer acting medication. Fentanyl's very short, Dilaudid lasts a lot longer. Say they gave her 2 milligrams of Dilaudid and 200 micrograms of fentanyl right when she came out, and then she rolled into PACU and she kind of woke up, and then they gave her another high dose. I mean, it is possible that there was a stacking effect of those narcotics, and that's what did it. It doesn't have to be necessarily enough narcotic that it just straight up kills her. If her respiratory drive goes down and she, say, has sleep apnea, which is very, very common, especially in people who are not super, super thin, and she wasn't like, obese or anything, but she wasn't rail thin either. She very well could have had apnea. The combination of those narcotics could have aggravated her apnea, and then they weren't able to oxygenate her, and then she gets a brain injury, and then all of this is explained. But I don't know. I think that's probably the most likely explanation, because it's like, okay, what else could it be? Well, the other thing that I initially thought is, hey, maybe Mommy Makeover included a Brazilian butt lift and she had a fat embolism. We know she had liposuction, and it is not uncommon that when people harvest fat that they'll do a Brazilian butt lift. Yeah,
and like if she did multiple, if this was her first like surgery, or like what if she started out with getting all these things instead of just doing the tummy tuck or any of that?
Yeah, I mean, there definitely is a lot of data out there to show that as you increase procedures, risks go up.
Yeah.
It's why I typically will only do 2 procedures on a patient at a time. I won't do the multiple 3 and 4 surgeries at a time. It's just too risky to me.
Yeah. That's where my
and we don't know.
prediction or curiosity goes.
I agree with
was
you,
there
100%.
multiple?
I want to know what she had done because it does give you more clues as to what may have happened. Because if, for example, they said, oh yeah, she had a tummy tuck, lipo, and a Brazilian butt lift, I would put my money on she had a fat embolism. But we don't know that. The other thing that it could be, which is really rare but is a possibility, is that we know she had liposuction, and a rare complication of liposuction is if that cannula, which is the hollow rod which you're sucking the fat out with, gets too deep, it can cause injury intra-abdominally. She could have had a small injury to, say, the mesentery, which is the fat in the blood vessels which supply the intestines, or maybe she had like a small injury to her liver and she was losing blood. And as you lose blood, your blood pressure starts to drop as the volume decreases. And then they gave her this narcotic, which also causes your blood pressure to drop.
Oh, goodness.
And it could have been a combination of that. And that would be totally different. Because as it stands now, I mean, it sounds like it was a narcotic issue and not anything to do with her surgery, which means she could have had, a mole removal and the same thing could have happened, right? And so I think that's, it is important to make that distinction. Like, is this a surgery problem or is this a, a medication problem? I don't really know what the answer is here, although I can make some speculations. I think the narcotics probably still is the most likely culprit, unless we find out she had, a bunch of other procedures, most notably Brazilian butt lift. But I do think that the information will come out. I mean,
when did this happen again? When I saw it said it was reported 5 days ago for me.
Yeah, so I was gone last week and it popped up on my feed like a week ago.
Okay.
So I think it happened.
Probably within the past month.
I think she went into, it did. She went into surgery like the 27th, I think.
Oh, goodness.
Of February. But then it was like radio silence for a week. And so like her husband ended up posting like March 6th or 7th, I think, which is and then it took a minute to catch traction, and I saw it like a day or two afterwards. So this is really, really recent that it happened. But
it's so sad.
Yeah, it's terrible. Like, I mean, you just hate somebody. I mean, obviously someone, lost their life, somebody lost their wife, somebody lost their mom. But, especially when it's something elective. I mean, that's my whole business is doing elective surgery. But I mean, that's, why we, try to figure out what these risks are and try to mitigate them to keep things like this to a minimum. And at this point, you just can't say what happened. Anybody who says, I know for sure what happened to her is just full of it. I mean, they don't know. I mean, you can speculate, and, some people will speculate wrong, some will speculate right, but until you get more information, you just don't know. But definitely a sad story and something definitely we will kind of keep track of. Again, not sensationalize it, but you like to be informed. Like, what happened to this person? How do we prevent that from happening again?
Totally.
All right, so have you heard of the well-known TikToker named Rachel Tussey? She's been on TikTok and she was documenting her plastic surgery journey. Well, unfortunately, she passed away just very recently, very soon after she had her surgery done. And it's a very sad story because she even posted it to her TikTok right before she was going into surgery about how excited she was. Then there wasn't anything for 7 days until her husband came on and said that something really, really bad happened and she was now in the ICU and had been declared brain dead, and they just shortly after that took her off life support and she sadly passed away. So we were discussing her case today because anytime somebody has a terrible complication like this from procedures which are known to be very, very safe, we want to know what happened. Now, we don't know all the details. We do know she had a tummy tuck, she had some liposuction, but we think that there were other procedures involved because it was said that she had a mommy makeover, which could include almost anything. I want to know if she had a Brazilian butt lift, because as we know, if you watch this program and you watch me, I don't like Brazilian butt lifts. They have a high risk of death due to fat embolism. But we don't know what procedures exactly she had. But her husband did say that she got a pretty hefty dose of narcotics in the PACU or the recovery room after she was there and awake and talking. And shortly after that, she basically went unresponsive and they had to start CPR, and she ended up in the hospital, and she did suffer from brain death due to anoxia, which is lack of blood flow to the brain. So a lot of people are speculating there was the narcotics. We know the dose she got because her husband said it wasn't a crazy high dose. It was a pretty normal dose for somebody to get after surgery. However, if she'd gotten a bunch of narcotics from the anesthesiologist right before she was dropped off in recovery, and then it was stacked with that high dose, it certainly could have caused this outcome. But it is a very sad story. We don't know all the details, but we're definitely going to follow this one because she had, at least on the face, surgeries that are very, very safe. So sad story, and we will try to update you when we learn something. So, all right, I got a follow-up segment, Brenna, and it actually goes along with this. The one thing I didn't mention in that last segment is I saw people on, you know how the comments are on TikTok?
Yeah.
I mean, it's a cesspool.
I honestly, like, that's part of my favorite part of diving,
like,
especially with the new
post says, let's go to the comments.
Yes, the comments crack me up, like,
Dude.
with those stickers and like memes in it. They get me so
and
good.
I'm convinced that half of those comments are bots. I mean, have you seen those bot farms
that's
where it's
so
like
true.
AI, and they're just like, I don't know.
Yeah.
I don't even know what
Sometimes the comments have more likes than the actual video. And
Yeah,
that's where it gets me. I'm
totally.
like, that's so funny. I would be so mad if I had like a viral
Yeah.
post and the comments had more
right, and the
likes.
comments have more likes. Yeah, that does happen a lot.
Yeah.
What's that called? That's called. There's a name for that, and it's called ratioing. Right?
I have no idea.
You don't know ratioing?
No.
How do I know this and you don't know
I
this?
don't.
It's called a ratio, right? If somebody makes a post and you don't like it, and you post that it's, you're saying this is a bad post, and you get more likes
Okay.
than
That makes sense.
then it's called you got ratioed. Yeah.
Yeah.
I can't believe I taught you something about social media. I feel good about myself today. Yeah. Okay.
I learned something.
Yeah,
so.
you did. Yeah. You can sometimes learn new tricks from old dogs.
There you
All
go.
God, how did we get off on the comments thing? I can't even remember.
That's definitely my fault.
I can't even remember. All right, I'm just going to start fresh. Right, the comments about the Rachel Tussey story, the very sad story of
Yes.
the TikToker who passed away after plastic surgery. And so I didn't mention this when we did that segment, but there were people in there saying, why did she have this done at a surgery center? That's so crazy.
Oh, yeah.
And they're always done in surgery centers, not to spoil my whole segment, which I'm about to do. But given the sad story of Rachel Tussey, the TikToker who died from plastic surgery, I wanted to do a segment on the safest place to actually have your plastic surgery. And I'm going to go over what all the options are, like where can you have plastic surgery, and what are the pros and cons of each. Because I think it's important, and this is something I talk about, not directly in its own segment, but I'm always kind of talking about it when things go badly, and I say, oh, by the way, this happened here, and I don't like that. So what are your options for the location that you have plastic surgery? Do you know, Brenna, I'm going to ask you this question, I'm not expecting you to know it, but like, what do you think? Literally, what are the physical places you could have? And I'm asking this not because I expect you to know it, but I'm asking as somebody who's not in the biz.
Yeah.
Like, do you know where these things are even done?
I don't know if I have the right terms
It's
for
okay.
like surgery
You don't have to have the right
center.
term. Okay, surgery center.
Yeah.
That's great.
I would think
That's
that.
perfect.
That's like my first
Okay, that's very, very good.
guess.
Yeah. Okay, so and I'm not asking this to put you on the spot. It's not
No,
like
yeah.
that. I'm curious what the average person who's
Yeah,
not
no, totally.
medical, thinks about it. Okay.
Yeah, I haven't really thought about it. So
Okay,
it's
all right, well, good. Then maybe this segment will be good
yeah,
for you.
but like if it was like someone's house, like I don't know if I would trust. I would
right.
not.
I
yeah.
didn't even include that one, but you are right. It could be something totally non-legit. I'm gonna add that one in the end because you mentioned. Okay, all right. So let's start at the top. Let's start at the most highest level of care, which would be the hospital.
Yeah.
Right, a full-on hospital.
That was like my second guess.
So, in a full-on hospital, most people would think, oh, that's the best. But there are some really, really great benefits to having surgery in the hospital, and there's also some big downsides. And so what are the big benefits? Well, a hospital has a full ICU or intensive care unit. It has the ability
If something goes wrong.
Yeah, it has the ability to take care of the absolute sickest patients and have it done immediately. Unlike the sad case of Rachel, the TikToker, like when she had a problem, they had to transfer her from that facility to the hospital, right? And there's a lot of time. You have to call
Yeah,
911.
like the 6 minutes of no oxygen.
Yeah,
That
and
was
that
probably
happened-
during that transition.
And that happened even before they even called 911.
Oh my
I
gosh.
think, right? And
Yeah.
so, you know, the time from, okay, there's a problem, call 911, ambulance arrives, ambulance assesses, ambulance, you know, maybe puts a breathing tube in the patient, loads him in the ambulance, takes him to the hospital, brings him into the ER. I mean, easily an hour can pass.
Yeah.
Easily, right? And so if you're having surgery in the hospital, that, you know, transition time doesn't exist. So that is a benefit. You also have an immediate access to specialists, right? All of the doctors are going to be in the hospital for the most part. I mean, if it's the middle of the night, perhaps not every doctor is there, but you do have doctors in the hospital 24/7. So hospitals are great for high-risk patients or high complexity cases where there's a, you know, significant risk of complication because of all those safeguards. However, if you're talking specifically about elective surgery, and even more specifically elective surgery that's out of pocket like aesthetic plastic surgery is, there are some downsides. First off, it is cost prohibitive. I've had patients before that came in for a consult for a cosmetic surgery, and for whatever reason, they had some medical issue that basically negated them from having surgery at a surgery center. And they would ask, well, what would it cost to do it at the hospital? And I've had 0 patients in 16 years who took me up on that, because when you get a quote from the hospital, it is astronomical.
Yeah, it skyrockets for sure.
Yeah. So like, for example, like to have like a tummy tuck and maybe your breasts done in a hospital, I mean, I didn't actually price it, but I would guess that the hospital fee for out of pocket would probably be minimum of $30,000.
Oh my gosh.
Like just the fee for the OR would be 3 times as much as the surgery would be if you had it at a surgery center. And that's like a low estimate. It could be 50 or 60,000.
Oh my gosh.
So that becomes cost prohibitive. So realistically, and I've been doing plastic surgery now, private practice, 16 years, which is a fair
And
amount.
you haven't done it at a hospital? Or have you?
Not anything cosmetic.
Okay.
No, I don't even think I've done any surgery out of pocket, which means it wasn't done through insurance in the hospital.
Okay.
I know we've asked a few times to get prices, and it always just ends there because the price is so high. I may have done one really short case in a hospital at one point. If I did, I don't remember it. But the cost prohibitive part is huge. Also, it's slower in a hospital. The turnover times are slower, which can drag out the day, which can potentially add some risk if there's not as many people around.
Is that because of like priority or in the hospital?
You know, I wish I could tell you. It just, things run slower in the hospital.
Yeah,
you know,
it makes sense from like
turnover time, like in a surgery center, is very rapid. Like they just have people that are there to make sure cases go smoothly. In the hospital, it's almost if it's not a priority.
Yeah,
you know,
that's exactly what I was.
It's very routine to finish a case in a hospital and not start your next case for a minimum of an hour or longer.
Wow.
And that's just the way it is. And so that does potentially set up some issues where, you know, maybe your case doesn't get to go because it took too much time and they don't have anybody left to work. And it's not necessarily safer for low-risk cases, because one thing about the hospital that people don't think about is there are a lot of very, very bad bacteria in hospitals.
Yeah, you're exposed to a lot.
You're exposed to a lot of different bacteria that don't exist in a surgery center.
That's
There's
so
a lot
true.
of multi-drug resistant.
Cross-contamination.
Yep, cross-contamination of multi-drug resistant bacteria, which are much more likely to be in a hospital than they are in a surgery center.
Yeah.
So, so to summarize, you know, should you have your elective plastic surgery in a hospital, and by elective I mean cash for service, so like a tummy tuck, breast aug, this and that, the other. I mean, absolutely not. Not to mention something I didn't even talk about was, in my surgery center, I'm set up to do these surgeries. I have the equipment I need. I have things like, you know, implant sizers. I have all the tools that are specific to these procedures, and they don't necessarily have those in a hospital setting. And so if you're trying to do these in a hospital setting, you may be trying to do it without the equipment that you're used to. So hospital is not a good choice. Now, next you have the ambulatory surgery center, or surgery center, however you want to call it, where the absolute majority of aesthetic surgery is done. And I personally think that these are the best. I think if I lay out the pros and cons, I think most people would agree with me. Why do I think they're safe? Well, a very, very high number of these surgery centers are accredited. And most good surgeons will not work at a surgery center that's not accredited. So what does accreditation mean? Well, it means that these different governing boards have basically told the surgery center what's required for them to get accreditation. They've done it, and then they've had site surveys to make sure that they're following through. And that could be like CMS, Joint Commission, the Quad ASF, and the AAAHC, which are these different governing boards which regulate what needs to be done to make sure this place is safe. What are the protocols? What are the emergency equipment, the emergency protocols? And it's actually really involved. And anytime a surgery center is about to have a site survey, they're like on high alert because there's a lot of stuff they need to make sure is done properly, or they could lose their accreditation. And they also have credentialing and privileging of surgeons. Now, hospitals have that too, but the next one I'm going to mention does not. You cannot go as a internal medicine doctor or a general surgeon or OBGYN and get credentialed to do plastic surgery. They're not going to give it to you. You don't have the proper training. You don't have the proper board certification. So there is that layer of protection that at least if you're in a surgery center, you know that your surgeon has at least been trained and certified to do what they're going to do. They do have a lot of emergency equipment in a surgery center. Probably not as much as the hospital, but they have a very good amount. And they have protocols for what to do if something goes wrong. So, in my opinion, ambulatory surgery centers are extremely safe. No, they don't have ICUs, they don't have doctors in there 24/7, but for elective surgeries that are not considered high risk, you don't really need that. Now, the last one, not really the last one because I'm going to add what you said, but the third one is office-based operating rooms. So that means that I open up an OR in my medical office, and that's where I do my surgery. And I'm not a huge fan of these. I've actually, both of the training programs that I was at had those. They had office ORs. And I do think that the guys that I trained with, because they were very legit and even in some cases famous surgeons, had really nice ORs that I think were on par with a surgery center. However, they're definitely not all like that because the regulation of office ORs is across the board. You'll get some that are really, really good and some that are just skating right above the law for what's required, and they don't have near the amount of equipment or protocols that a surgery center would have. So although I think an office OR could be very close to the safety of a surgery center, you as a consumer have no idea whatsoever if it actually is. Even I would have to dig a lot to find out if somebody's office OR was truly safe.
That's true.
What certifications does it have?
Yeah.
When was the last time they were certified? What emergency, protocols do they have? What emergency equipment did they have? Because the laws do not necessarily protect patients. You can run a super shoddy OR in a lot of states, Texas and Florida included, that technically you can do surgery in them, but they are a far cry from the safety of a surgery center.
I was going to ask, is that what, I guess out of the country usually is OR?
Who knows?
Or Miami?
Yeah, who knows? I mean, if it's one of those things where I can't tell if it's safe, how is a patient going to know? How are they going to know? You can't tell by looking at a website.
So scary.
Yeah, it's very
like those
sketchy.
horror movies. I'm watching, this is kind of off topic, but I'm watching The Hunting Party on...
I haven't seen it.
It's a show on Netflix. It's new. But basically, every episode is they're trying to catch, I forget what they're...
Like a killer?
A serial killer.
Okay.
Yeah, I
is
was
it a reality show or is it fiction?
No,
it's
definitely fiction, but... Yeah, but the last episode I just watched, he was a surgeon. So basically he was killed and brought back to life. So now he does that to his patients to try to see what they saw whenever they died.
It's like that. Have you ever seen the movie Flatliners?
I think so. Is it old or is it a newer one?
So there was the original, which was like in the 80s or 90s.
I think my dad made me watch that one.
Yeah, basically it was medical students that were basically putting themselves into cardiac arrest to see what death was like. And
Yes.
and they were having these weird kind of visions and
Yeah.
stuff. I think they made a remake too, actually. But yeah, yes.
Anyways, don't know why I brought that up, but
Well, because
it's scary. You can't.
because
Who's reliable?
You could not do what that guy was doing in a surgery center or a hospital, but you could do that in your own OR. Do something really weird like that. Now, eventually, you would get caught, but. You know, if you try to do something like that,
it can do enough damage.
Yeah, in a surgery center, they're not going to let you do something that's off the rails. It's like those cases that we talked about where, you know, the patient went into cardiac arrest and the surgeon wouldn't call 911 for hours.
Yeah.
That stuff can't happen in a surgery center. Also, there is no credentialing. You know, I mean, and that's where these non-plastic surgeons, these fake plastic surgeons, cosmetic surgeons, do all their work. They don't do them in surgery centers. Why? Because they can't get credentialed. But can they credential themselves in their own OR?
Yeah.
Yes, they can. And no one's asking them, you know, when their OR gets whatever, you know, piece of paper it needs, like, what's your credentialing like? So I'm not a big fan of office ORs. There are some out there that are extremely safe. And I'm not saying that everyone is bad, but it's just that unpredictability of, is this one safe?
Right.
I don't know.
How reliable?
I don't know. I don't know if I could tell. I would have to like dig into it, and it's like, I'm not going to deal with that. That's one of the reasons I haven't done my own OR. Plus, it's just kind of a hassle, to be honest. So, and then, like you said, okay, what about having plastic surgery like in a back alley? Okay, obviously bad, right? I mean, I don't think anyone's going
like a McDonald's address.
Do it. I mean,
where am I?
We talk about it all the time. People like have plastic surgery in someone's apartment or like a hotel room.
Yeah.
Obviously, don't do that. That's very, very bad. But yeah, you know, and going back to that Rachel Tussey case, I mean, we don't know all the details, but it sounds like it may have been a medication issue, which that literally could happen anywhere. That could happen in a hospital, that could happen in a surgery center, that could happen in someone's office OR. You know, the one thing I will say is if it happens in a hospital, at least you don't have that delay to get to the hospital. But again, there's downsides to doing these type of surgeries in a hospital. One, you can't afford it. It's unaffordable. And two, there's always that risk of catching like some, you know, super
I didn't even
bacteria.
think about that. I would have thought like hospital would be like right up there, but
it is and it's not. It's like there's pros and there's cons. I personally would not want to have elective surgery in a hospital. Personally, I would much rather go to a surgery center knowing what I know. Now, if I'm having something, you know, really crazy like open heart surgery, well, yeah, I want to have that like in a full-on hospital. But like if I was having, you know, my gallbladder out or I don't know, something like that, surgery center all the way. So. But yeah, that kind of rounds it out. Like to me, surgery center is the best. I mean, I guess office OR has to be second because hospital is just not realistic unless money is no object, which it's always an object.
Right.
So, you know, realistic plastic surgery happens most commonly surgery centers. Office ORs are a thing, but you just got to be careful, and it can be very difficult to know what's what. So.
Totally.
All right. Have you ever thought, where is the safest place to have plastic surgery? Well, it's something we discussed just recently when a well-known TikToker, Rachel Tussey, passed away after having a mommy makeover, and there were people online saying, why did she have this surgery in a surgery center? That's so crazy. Well, actually, it's not. Most plastic surgery is done in an ambulatory surgery center. Why? Well, some people think a hospital would be the safest place to have surgery. And it is true that a hospital has an ICU. It has specialists there available pretty much any time, doctors 24/7. Yeah, that is a lot of positives. However, there are two downsides and a few more to having elective surgery in a hospital. One, if it's out of pocket like cosmetic surgery is, it's completely cost prohibitive. It can be 10 times the cost. A tummy tuck could cost you $50,000, which no one is gonna pay. So right there, that pretty much ends any conversation about having plastic surgery that's not insurance-based in a hospital. But also the thing that people don't think about is there are a lot of resistant bacteria in hospitals. I personally wouldn't want to have elective surgery in a hospital because there's always that risk of cross-contamination where you get, you know, a really resistant Pseudomonas or some superbug that really could make you sick. So hospital really not an option for cosmetic plastic surgery. Surgery centers are far and away the most common. They are very, very safe. Approximately 80 to 90% of ambulatory surgery centers have accreditation, which means these different boards come and say, hey, this is what you need to be safe, and they do it, and they get site visits, and they get their certification to say, hey, this place is doing things the right way. So the overwhelming majority of plastic surgery is done in surgery centers. The other alternative is office ORs. Now, I've worked in a couple places that had office ORs. I thought they were good, but there are two things that are question marks. One, the accreditation for surgery center or for office ORs is all over the map depending on state. Some states have very loose regulations on who can do what in an office OR, and they don't have credentialing. You could have a dentist doing your tummy tuck and no one is going to stop them because there's no credentialing. Also, you just don't know about their protocols. What is their infection protocol? What is their safety protocols? What is their emergency equipment? And so I do think that there are some outstanding office ORs that can rival a surgery center. It's just that question mark that makes me not like office ORs. I've never been a huge fan of them. I never wanted to open up my own. For me, the safest place to have plastic surgery that is elective and cash pay is an ambulatory surgery center. So, there
Awesome.
you go.
We got a comment.
Oh, comments.
My wife's mommy makeover is performed in an ambulatory center by the best stock in Denton.
Oh, is it me? Or was it
I
someone
think
else?
so.
Maybe it was me. I don't know. I hope it was me. If it was a mommy makeover, it probably was me because
Yeah.
I do the most of those in Denton. Well, whoever that is, I'm going to assume it was me. Thank you
Yeah.
for saying that.
Shout out.
Yeah, shout out. Yay.
He's like, it's not you.
It's not you. It may not. There are, so like in
yes, it was you.
Oh, it was me? Okay, all right, excellent.
Yeah.
In my area, I probably do 90% of the cosmetic surgery in that county. I don't know. I know who operates at the place I'm at, and I know how many cases I do and how many they do, and I do tons and tons more. But I mean, whatever. I'm kind of old now, so it's kind of just what my practice has become. But okay, I'm gonna need your help on this one, Brenna. This next segment.
Ready.
Are you ready?
I am.
Okay. Do you know about Looksmaxxing? Have you heard the term?
I can't say I have.
You haven't heard the term?
Maybe I'm just like uncultured. I don't know.
Honestly, Brenna, I appreciate that about you because it means you're not like stuck on TikTok all day. I actually have heard of Looksmaxxing. I had a very good idea of what it was, but I did go and actually look up the definition. I was like, okay, I was right. I knew what this was.
Yeah. I feel like my TikTok though is very repetitive. Like a lot of it's ads. Like a lot of it is stuff that I'm like, oh, I like this, and I've looked it up, and now I just keep seeing it,
Right,
and I'm
know.
just like, how do I expand my TikTok page? Like I don't know.
You know, you have to like not look at the stuff that you
Yeah.
like and start liking other
That's so
stuff, or like
true.
search for stuff that's different and then like and comment, and then it'll swap the algorithm. I mean, that's how doom
Noted.
scrolling happens, you know.
It's true.
Right? Because you look at stuff you hate, and then the algorithm's like, oh, this dude loves like bad news. Let's try
Yeah.
and tell him all about the bad news. Okay. So Looksmaxxing, for those who don't know what Looksmaxxing is, it is basically what you probably think. It's a term describing the efforts to enhance the male appearance through lifestyle, stylistic, or drastic physical modifications. And so this is a segment on Looksmaxxing by facial bone smashing. Yes, bone smashing, and this is probably what you think. So on TikTok, there is now this trend of content creators known as Looksmaxxers who review topics about facial harmony, bone structure, masculinity, and these guys really don't have any idea what they're talking about, a lot of them. It's not like it's a plastic surgeon talking about Looksmaxxing or some aesthetic guru. I mean, these are guys who probably look good genetically, and they're like, hey, I'm gonna talk about Looksmaxxing. So one alarming topic that has been thrown around for a little while now, but it's got a little bit more traction because there was a news article about it just recently, is bone smashing. Now, Brenna, have you heard of bone smashing?
This sounds terrifying.
I had not heard of this either until just a week or two ago. And it's one of those things where I'm like,
this cannot be legit.
Is this
There's no
real?
way people are doing this.
I think they are. I think they are. I feel like a lot of things on social media these days are fake. It's like the flat Earth people, right?
Yeah.
When we talk about flat Earth, and I was like, oh, I used to be part of a flat Earth group. Obviously, I don't believe the Earth is flat. It was a joke, right?
The only like beauty thing that I've fallen for is like the gua sha, which like I know it's like a stone and you like do it on like your face for like
you're
lifting.
talking about like jade rollers or something?
Yeah,
different?
but now they have a gua sha.
Oh, it's new. Jade
Yes,
rollers.
the rollers like those are good for like probably like depuffing or whatever. But
we did a segment about the jade rollers years ago.
Yeah.
It was what you'd expect. I mean,
Yeah.
they are what they are. They help a little bit. Okay, so bone smashing.
Oh,
and there's
so
actually,
crazy.
I did actually find, you've heard of clavicular, right? The influencer.
maybe I'm so bad with names.
Okay.
If I saw, maybe.
I don't know clavicular. I've heard his name, and then my daughter knows who he is, so she's always asking me about clavicular. Like, what do you think about claviculars getting mogged at the frat party? I'm like, I don't care.
Yeah.
Anyway, so I found
Can't say I know.
I found a video. All right, so it should be
Okay.
the only video. Roll this video.
My mom used to take these away when I was growing up because I was always bone smashing with a hammer. You know?
Yeah.
She had to hide them.
Bone smashing's available.
Dude, yeah, they literally had to hide the hammers. So
I got a few friends who do it all the time. They just bang on the face.
you do it or what?
No, I'm not a big bone smasher myself, but my friend Adam Thomas, he like loves that shit. He lives for it.
Yeah, exactly, bro. You gotta hit the chin hard.
Yeah. One sec, let me get a few hits.
Yeah, get a few hits. Hell yeah. Hell yeah.
Dude, I already feel it.
You feel it?
Yeah.
You feel your bones growing? I don't need it anymore.
That's awesome.
Yeah, it's pretty fun. Yeah.
All right, so according to TikTok, if you don't have a chiseled jaw, you just have to smack yourself in the face with a hammer, and
That is awful.
like you're all set.
Oh my goodness.
So bone smashing aims to alter the facial bone structure by inducing hypertrophy through repeated trauma, typically done
I still
with,
hear the sound of it.
Yeah, dunk, dunk,
The
dunk,
nut-
dunk,
oh
dunk.
gosh, I hate it.
Yeah, commonly using a hammer, as was seen in that video of those obviously Oxford scholars who were teaching us about bone smashing.
Yeah.
So, I had that question too, Jenna. Brenna. I have a nurse named Jenna. Sorry, I didn't just
No
randomly call her one name.
worries.
Brenna, I had the question of like, is this legit? Are people
Right.
really talking about this? Well, bone smashing actually has 300,000 monthly
Oh.
searches.
Monthly.
And the videos about it have millions and millions of views. So now, does that mean that it's a huge thing? No, but it does mean that people are like posting about it and people are looking about it or
We
looking
got some
for
comments.
it. We already got bone smashing comments.
Yeah.
Oh, bring them on.
You know, inflammation does not equal bone growth. Please stay in school, kids. Also, your wife said that y'all need to get me connected to Danica on TikTok for TikTok lessons.
Oh, right. That's my daughter, Danica.
Oh, okay. Oh, I'm sorry.
Yeah, no, it's fine. That's fine. Whoever
Yeah.
said that about inflammation is spot on. Who is that? Who said that?
I want to crew. I'm so sorry. I'm probably mispronouncing. Crew on Danette.
No, I don't know who that is, but they're absolutely right. That is something I'm going to talk about, so good job to them. Okay,
Yeah.
so the theory of this is based on an actual law of medicine called Wolff's Law.
Oh my gosh.
So Wolff's Law is the law that states that bone will remodel in response to mechanical loading and cause hypertrophy, okay? So this is very similar to either what happens to your bones with weightlifting when there's that constant tension on them, you will get bone hypertrophy, or orthodontics or orthognathics where you're either adjusting your teeth or your jaw bones by putting tension on them. So these bone smashers are trying to use Wolff's Law to say that, oh, if I smack myself in the face with a hammer, that suddenly I'm going to get a jaw like an anvil. Unfortunately, that doesn't play out because trauma does not equal the hypertrophy stimulus that you get from a more mechanical load type stress. Blunt force trauma causes micro fractures in the bone, hematoma, inflammation, like that one person talked about, which is they'll get inflammation, they'll get swelling, and they're like smacking themselves with a hammer.
Bruising for sure.
And bruising, and then what happens is like wherever they're hitting like swells, they're like, look, my bone's growing. It's growing so fast, I keep hitting myself, and the bone keeps getting bigger.
No.
So what happens when you smack yourself, and you get these little microfractures, the inflammation, your bone goes into repair mode, not hypertrophy. So instead of like getting a stronger jawline, you could get a crooked one.
Yeah.
Because the repair mode is chaotic. It's not kind of controlled like the Wolff's Law is when you're doing it with weightlifting or orthodontics or orthognathics. And not only that, I mean, there's real risks with this. I mean, you could get serious fractures that would require you to have surgery. I don't do as much craniofacial surgery as I used to, but there was a time in my career when I did craniofacial trauma. So if someone broke their jaw, broke their nose, broke their zygoma, broke their orbital rim, I would go in and fix those. I kind of got out of it because I didn't love the cases. And
I want to see some like before and after results of this.
No, there's not any.
Exactly.
I mean, the only befores and afters you'll see is like when they smack themselves with a hammer and suddenly
Who started this?
I don't know.
I just want to have a few words.
I don't know, man. This is like the downside of social media. It's like some of the dumbest things you've ever heard of will take off.
Yes.
And it's just, they just keep going. Like this has been around now for a couple years.
Yeah.
That people have been talking about this. And it's like, why do I have to tell someone that smacking themselves in the face
with
with a hammer is a bad idea?
Like,
are we that dumb as a society now that you think that if I smack myself in the face
this is a great idea
with a hammer, that it's going to be good for me?
Right.
Like, I just don't get it.
DIY.
I mean, aside from fractures, you can get injury to nerves. You have lots of facial nerves that can get injured. You can get vision complications if you jack up the muscles. You can get deformities because, again, the healing phase is more chaotic than the controlled version with Wolff's Law. So, I mean, although it's true that stress to the bone can cause hypertrophy, this does not correlate with smacking yourself with a hammer.
Right.
There's not really anything I've seen that you can do at home to cause hypertrophy to your bone outside of things like working out, right? If you hit the gym, like you'll get bone hypertrophy.
The gym?
But yeah, bench press. Yeah. It's been a while since I've done that at the gym. Yeah, I mean, for trying to improve your jawline or your cheekbones with Wolff's Law, I just don't see a way that's going to happen. And if you smack yourself in the face with a hammer, I mean, you could really hurt yourself. I mean, how do you explain that? If you go to the ER and you have like a broken jaw and like, what happened? Like, oh, I smacked myself in the face with a hammer.
Right.
I mean, I'd be like, you need to be like in a rubber room. I mean, that's just not like what normal people do, right?
It's like child-proof scissors, child-proof a hammer at this point.
I know, it's crazy, right?
Yeah.
I mean, it's just unbelievable. So
Cindy said we're living out of movie Idiocracy in real life.
Oh, dude, Idiocracy is coming true.
Yeah.
People didn't think that was a documentary, but it is.
Here we are.
It totally is. So I'm going to recap this one. Do I have to tell you not to smack yourself in the face with a hammer? Well, apparently I do, because Looksmaxxing TikTok is now talking about bone smashing, which is literally where you take a hammer and you hit yourself in the face in an effort to get your bones to grow heavier, to get that anvil jaw or those chiseled cheekbones you've always wanted. So does this work? Absolutely not. It doesn't work. Don't smack yourself in the face with a hammer. I mean, you can actually fracture your bones, which would require surgery. You can get nerve injuries. You can cause vision problems. You can get a crooked bone instead of one that actually looks the way you want. Now, this actually comes from a somewhat known idea called Wolff's Law, which does say that if you put enough stress on a bone, it will respond with hypertrophy. It's what happens when you work out with weights. Your bones get stressed, you get bone hypertrophy, and that's a good thing. Also, it's the principle behind orthodontics and orthognathics, where you're changing your teeth or some of your jaw bones by using plates. But guess what? That's controlled with surgery. It's not smacking yourself in the face with a large metal object. Like, it does not correlate that that's going to give you what you want. I almost didn't believe this was real until I found videos of people doing it. And man, what can I say? Please don't smack yourself in the face with a hammer. I can't believe that has to be a public service announcement, but here we are. So There you go. All right, Brenna,
Wow.
good episode.
Yeah.
Yeah, that was a good one. You did a great job. Thank you
you.
for helping, carry. Nobody wants to hear me just up here chattering by myself. You have to distract the audience.
Right.
You have to chime in so that they
I
stop
learned
just
a
me.
thing or two, so.
Did you? Oh,
Yeah.
That's good. I have some really good topics for next week.
Awesome.
I was going to do them this week, but I forgot Kalee was going to be here, and I was like, oh, I'll just save them. So we got some good ones coming up.
Yeah.
We got some.
I'm excited.
I'm going to do a conspiracy theory one too.
Yes.
So
Love
get
those.
ready. All right. Well, everybody, thank you guys so much for tuning in. We really, really do appreciate it. Please crush that like and subscribe button. Turn on those notifications. It helps a lot. And if you want us to do a segment on this show about pretty much anything, I'm game. Leave me a comment. Say, hey, do a topic on this, and I will do it. And it might be next week on the next episode of Nip Talk. Bye.